This is an educational session on the lumbar spine or your low back. Low back pain is one of the leading causes of immobility. New research indicates better outcomes from conservative management of pain over surgery. While there are some instances that surgery is necessary, this is something you can consider and discuss with any healthcare provider. In these videos, we'll be discussing how to conservatively manage low back pain. There are 4 common causes of low back pain. The most common is a disc herniation or disruption, which you commonly hear people talk about. These symptoms oftentimes present immediately after lifting something heavy or first thing in the morning. These symptoms typically prefer to be lying on your stomach. If lying on your stomach relieves your pain, that is a good thing. Do that. Do what relieves your pain and find positions of comfort. What happens during a disc herniation is there is leakage of your disc inside the space between your vertebrae. Sometimes, not all the time, this can cause irritation of a nerve root. This is where that pesky sciatica comes in that a lot of people talk about. Your sciatic nerve comes out of your low back and travels down your leg. So symptoms from the low back or down the hip, down the back of the thigh, down the leg, oftentimes described as shooting pain or electrical pain, is oftentimes associated with a nerve problem coming from the back. Another symptom of low back pain is stenosis. That is a very common diagnosis that comes on with people who are over the age of 65. That is where you hear about that narrowing in your joint space in your back. While that sounds alarming, it's important to know that you don't have to be alarmed by that. You can learn ways that you can move around that does not require surgery. Now, if you start having more severe symptoms like the inability to control your bladder or your bowels or losing sensation, those are big red flag issues and you should seek medical care for that. Another common cause of low back pain is simply poor control. This is oftentimes called lumbar instability, lumbar hypermobility, multidirectional instability, lots of kind of scary words. The really important and good thing to know is that you have muscles all around your spine and their whole job is to support you. So if we have a natural girdle, a natural back brace built into us with our muscles, why would we not strengthen that? It is a very easy diagnosis to treat and to conservatively manage. The important thing is improving the strength in those muscles. Lastly is a spondy. A lot of people here talk of a spondy, a spondylolisthesis. This is simply a vertebrae sliding forward on another vertebrae. Again, sounds very scary, but the good thing to note is there are positions of comfort. If kind of being bent in a ball or bending forward makes you feel better, that's something you should continue doing. There are certain levels of lumbar instability that do require surgery and medical intervention, but a lot of them can be conservatively managed with strengthening and mobility exercises. If you have any questions, feel free to reach out to me. I love to help people feel educated about what's going on with them. You also have access to medical care that you can seek out, and you can reach out to doctors, to physical therapists, to anyone that makes you feel comfortable that you can discuss what is going on with you.